It's time to confront a harsh reality about Biden's expanded COVID-era health subsidies. Their expiration shouldn't just be accepted. It must happen as planned. The Biden COVID credits dramatically broadened Obamacare's premium tax credits, scrapping previous income limits and greatly boosting subsidy amounts. Now, households earning over $500,000 annually can receive significant government help with their health insurance premiums. Thanks to these expanded credits, nearly 42% of those enrolled in Obamacare exchange plans enjoy fully subsidized health care coverage. But here's where it gets controversial. These generous benefits are set to end at the close of 2025, returning premium subsidies to their original, narrower rules starting in 2026. While premiums will indeed rise then, the primary reasons behind the increases are Obamacare's inherent flaws, not simply the loss of Biden's COVID credit enhancements. Extending these subsidies into the future would saddle taxpayers with an enormous projected cost of $448 billion over a decade, a staggering sum that raises tough questions about fiscal responsibility and government spending priorities. To fully grasp this debate, let's unpack the history and details behind these credits. Understanding Obamacare's premium tax credits, PTC, the Affordable Care Act, ACA, commonly called Obamacare, was enacted in 2010 with the goal of expanding government involvement in healthcare and increasing insurance coverage. Starting in 2014, it introduced premium tax credits to help individuals and families afford insurance purchased through state or federal exchanges. Despite being called a tax credit, the PTC usually doesn't operate like a traditional tax credit claimed on annual returns. Rather, the government often pays the subsidy in advance, directly to insurers, reducing the monthly premium amount that insured individuals must pay. Originally, these tax credits were available to people who met several criteria. Household income between 100% and 400% of the federal poverty level. Not eligible for other health coverage sources like employer-sponsored insurance, Medicare, or Medicaid. Enrollment in a qualified Obamacare exchange insurance plan. The subsidy amount depends largely on the cost of a benchmark plan, a second lowest cost silver tier plan, and what the individual is expected to contribute. This expected contribution is a percentage of monthly income that scales with income level. Lower income households pay less proportionally, while wealthier ones pay more. This sliding scale adjusts each year based on factors like premium increases and income changes. Notably, these original PTC rules are permanent federal law without a built-in expiration date. How Biden's COVID credits changed the game. In response to the COVID-19 pandemic's economic fallout, the Biden administration enacted temporary expansions through the American Rescue Plan Act of 2021, ARPA. This legislation, 1. Remove the income cap, allowing anyone, regardless of income, including households making over $500,000, to qualify for subsidies. 2. Drastically increase subsidy sizes by lowering or even removing the expected premium payments required from participants. Initially intended for 2021 and 2022, these expansions were later extended through 2025 by the Inflation Reduction Act of 2022. The impact: who benefits and how much? By lifting the income ceiling, wealthy households can now receive thousands of dollars annually in subsidies. For example, a family of 4 earning over $500,000 or an individual making more than $250,000 can still qualify for these government-funded health plans. The Congressional Budget Office estimates that 89% of the additional cost from extending these credits would stem from new enrollments, many from households beyond the original 400% poverty line limit. Before this expansion, subsidies were only for those making up to 400% of poverty level, roughly $128,600 a year for a family of four, which already exceeded the median U.S. household income. Additionally, the Biden COVID credits have significantly reduced the expected premium contributions required from enrollees. Households earning between 100% and 150% of the poverty level pay nothing out of pocket, as their premiums are fully covered by taxpayers. This contrasts with previous rules that required a contribution between 2% and 4%. For context, a family of four at 150% poverty level, about $48,000 to $225 annually, would have paid approximately $166 a month under the old system. Data from 2024 shows that 42% of Obamacare enrollees enjoyed fully subsidized plans, and 79% paid $100 or less monthly. Proof of how expansive and generous these subsidies have become. Even middle-income households receive more assistance. A four-person family earning $96,500 formerly had to pay nearly 10% of their income, $790 a month, for insurance under the pre-Biden rules. Now, that contribution is reduced to 6%, $482 a month, with taxpayers covering the gap, meaning an annual subsidy increase of about $3,700 for a household earning close to $100,000. The fiscal reality, costing taxpayers billions. These expansions haven't come cheap. Between fiscal years 2021 and 2024, spending on Obamacare subsidies surged by 73% compared to initial projections before the Biden administration's changes. Should the expanded subsidies be extended permanently, experts estimate an average deficiency increase of $40 billion per year, adding up to $383 billion across the next decade, before accounting for interest fees. When factoring in the additional federal interest accrued on this added debt, the ultimate cost soars to approximately $448 billion by 2035. Importantly, the Biden COVID credits don't lower insurance premiums themselves. They simply shift costs from individuals onto taxpayers. What's next? The sunset and renewal timeline. These enhanced subsidy rules are set to expire on December 31st, 2025. Beginning with coverage in 2026, subsidies will revert to Obamacare's original, narrower guidelines. The open enrollment window for 2026 plans will run from November 1st, 2025 through January 15th, 2026. With coverage starting January 1st, 2026. Why let these credits expire? A case against extension. There are compelling reasons for allowing these subsidies to sunset as originally intended, with no congressional or executive intervention. Temporary by design, created as emergency pandemic relief, these subsidies were never intended to last beyond the COVID-19 crisis, which officially ended in May 2023. Partisan origins. Both Obamacare and the Biden COVID credits were enacted through Democratic-led efforts without Republican support, reflecting sharp political divides regarding healthcare policy. Funding controversies. Subsidized Obamacare plans are not subject to the Hyde Amendment, meaning public funds can pay for elective abortions, an unsettling fact for many. Extending these credits would increase taxpayer dollars flowing towards such coverage. Massive price tag. The $448 billion projected cost over 10 years could worsen the already alarming federal deficit, adding pressure on government budgets and future fiscal stability. Fraud and abuse. Estimates suggest millions are improperly enrolled in Obamacare exchanges.